All right, Chapter 9, Toddlers and Preschoolers. So in this chapter, again, disclaimer, I don't own the material under fair use. I'm providing lecture only for my nursing students. All content within is for educational purposes for nursing students and not to provide medical advice. So in this chapter, we're going to look at identify normal growth and development for toddlers and preschoolers, nursing assessments for that age, risks, safety interventions, and pain scales, along with nursing interventions and education regarding pain and safety, and the different challenges faced by toddlers and preschoolers. So, when we're thinking about toddlers, we're considering that the theorists in this age, the big ones are Erikson's, Piaget, Freud, and Kohlberg. So Erikson, autonomy versus shame versus doubt. So if you think 1 to 3, think about the 2-year-old, terrible twos. Piaget was pre-operational, so that's from 2 to 7. Pre-operational, characterized by magical thinking, belief that personal thoughts have a direct impact on the real world, egocentrism, and inability to see things from another's perspective. So this is when they have trouble with death. They have magical thinking that the loved one is going to come back the next day after they die. They don't understand death. Freud, anal stage. So these kids are working on bowel movements. And then Kohlberg is pre-conventional. So in Kohlberg's theory, they are moral reasoning stage and they tend to follow rules for fear of punishment. The motor development of a toddler, you can think about this age as walking alone by 15 months, beginning to run. They stand on their tippy toes. They can climb stairs while holding on to a support about 21 months. They build towers about 4 or more blocks by age 2 and 6 blocks by age 3. They kick a ball. They can climb on furniture by age 2, pull or carry toys while walking, run and jump by age 2, play on a riding toy like a tricycle by age 3, so 3 years to 3 wheels, and then turn a doorknob. The language skills that they're dealing with is pointing to objects, recognizing the names of well-known people and things, learning their own name, understanding more than they can speak, repeat words that are overheard. They repeat 5 words by 12 months, 50 words by 18 months. So a huge jump. And they can speak in 2 to 3 word sentences by 2 years old and converse in 2 to 3 sentences by 3 years old. Their favorite words are I, me, and you by age 3. And then the cognitive skills of a toddler, finding objects that are hidden, beginning to identify and sort colors and shapes, begin to make believe, and begin to scribble and show preference from one hand over the other. So you really are looking at promoting self-care at age 2 because they're going to say no to everything. So that's the time where you can actually get them to do some self-care, providing limited choices, giving them a sense of routine and control. The social and emotional milestones of a toddler, they imitate others. They have an awareness of self separate from others. They begin to spend enjoying time with other kids. They are in parallel play, which means they're playing near other toddlers, but not consistently interacting or playing together. They show affection openly. They begin to display defiance, the terrible twos, and they display separation anxiety when approximately at the end of the 2nd year. So they express jealousy at the arrival of a new sibling, which is usually when most people start having their 2nd child, is during this age group. So we will talk more about that as well. So the preschooler, 3 to 5. So consider that preschool. We're probably going into pre-K, age 3, age 4. So that group, Erickson is doing initiative versus guilt. So initiative, they begin to assert power and control over their environment, and the opposite result of feelings of guilt and dependence on others. Piaget is pre-operational, magical thinking still. Freud is in the phallic stage, so that's where they're deriving pleasure from genitals. And preschoolers might view the opposite sex parent as a sex object. Kohlberg is moral reasoning, developing an obedience versus punishment mentality. So providing lots of feedback, good job, lots of good jobs. And the child might feel that an illness is punishment from being bad. And that's part of their magical thinking. So if they get sick, they might think it's because they didn't do something. Some motor development. Let's go back. Motor development in this age. They dress and undress with assistance by age 3, later without assistance. They go up and down stairs without assistance by age 3. They draw squares, circles, and later triangles at age 3. They begin to use utensils and drink from a straw, or drink from a cup at age 3. Hop and stand on one foot for 5 to 10 seconds at age 4. Throw objects overhand at age 4. Catch a bounced ball at age 4. Draw stick figures with more than 2 parts at age 4. So eventually later they'll draw people with bodies. They use scissors at age 4. They brush their own teeth and go to the toilet without assistance by age 5. That's kindergarten. And they learn to skip, ride a bike, and swim by age 5. So that's your kindergartner. The language development, preschoolers usually speak clearly enough for strangers to understand, speak in 3 to 4 word sentences, 3 to 5 word sentences by age 4, and speak in sentences of 5 or more words at age 5. They love to tell stories. They use the future tense. They can rhyme with you. So wish, dish, fish, ball, wall, wall, doll. They later state their age and their full name and their address. So think about 5, 6. Concrete, literal interpretation of language. Children in this age group have a cognitive ability to recall parts of a story, count to 10, but they have no concept of numbers. They can identify at least 4 colors. They have a concept of time. They know the difference in meaning of same and different, and they begin to use imagination and creativity. And their favorite question is why? But why? The social and emotional milestones of a preschooler: being independent, proud of their abilities, and they show interest in things. They want to do things by themselves. They'll obey rules. They engage in role play. They play well with others. They're in associative play, out of parallel play. They want to please and be like friends. They want to negotiate problem solving. They believe in monsters and they're afraid of the dark. They have the understanding of gender and racial differences. They begin to explore their genitalia. They can be demanding or eager to help. They're jealous over the arrival of new sibling, and they place importance on body integrity. So they might obviously see that somebody else is different. They have a fear of the dark, so it's good to have a nightlight and a bedtime routine. So when getting a health history from kids in this age group, the biggest thing is just get down to the chief complaint. The family history, the medical history, any medications, allergies, a review of the system. Are they sleeping, eating, and eliminating the same? And the social history, more of the living arrangements. Do they go to daycare? Do they go to preschool? And what is their behavior at school? The general assessment is head to toe, just like anything else, obviously leaving the most painful areas for last and going from least to most invasive. So most of the time, these kids will be cooperative with an exam as long as it's performed in the toe to head maneuver, least invasive to most invasive. So start with their toes and work towards them. After they get that you are not scary and their mom is not screaming at you, then they'll be fine. So their physical assessments will be height, weight, head circumference, and vital signs. So height, standing, they can stand recumbent. Lordosis is common in this age group, so you're not going to see them be real stiff, tall. Weight is in a minimum clothing and a diaper, underwear, only if preferred for accuracy, and use a body mass index for kids older than 2. Head circumference, we should be measuring that for all children younger than 2, but after 2, it's usually difficult because of the bone growth and the growth of the head. Vital signs within normal limits. So within normal limits for a toddler is 70 to 110 pulse rate, 20 to 30 breaths a minute, and their systolic is 90 over 105, or diastolic 50 to 70, 55 to 70. So you can see those in your book. Again, a general appearance would be clean, dressed, appropriate behavior. And then the hearing, vision, and speech screening for any delays or difficulties. And the nutrition, you just look for hair that's evenly dispersed and a child visibly not overweight or underweight, and that their skin is not overly dry. Head to toe, ears, eyes, nose, throat, torso, skin, back, lymph nodes, masses, rashes, pain, or abnormalities. And then in the extremities, you're looking for range of motion, symmetry of length, strength, and variations in the skin. Abnormalities of the hands, feet, or joint. So some critical physical differences. They have proportionately larger heads compared to their body. Their larger tongues proportionate to soft tissues around the airway so that they can close their airway very easily. Their shorter, narrower airway is more elastic and collapsible. They have a pliable chest, weaker abdominal muscles, so it creates the look of distension. They're belly breathers, and they have higher fluid volume and total volume of blood as well than an adult. So the clinical judgment, just look at the child and are they able to participate and are they comfortable during the assessment. Talk to the child and tell the child that they're going to have a tight hug when they're getting a blood pressure check. Allow the child to select which arm. Protecting the preschooler's modesty and get down to their eye level. Use praise whenever is appropriate. The visual assessment, you're going to note the child's appearance, rashes, see things they're having trouble with, breathing, skin, bruises, lesions. You can auscultate their lungs. Heart sounds for a full minute. Palpate pulses, abdominal mass, scalp for fontanelles, which should be closed by 2. And the breath sounds, sometimes the nurse will hold up an index finger and tell them to pretend that it's a candle and have them blow out the candle. That creates a fun atmosphere where they're able to take deep breaths to adequately assess your lung sounds. The other thing would be to play bubbles. And then on the growth chart, we'll talk about growth charts as well. That's important to know that they use growth charts in this age to make sure that we know. So some safety things. Nursing interventions with safety, just figuring out what kind of bed they're in, Congenital malformations, assault, homicide, diseases of the heart are the greater risks of injury. Accidents are the biggest, from 1 to 4. Neonatal injuries are falls, objects being struck, and bites and stings. Injury rates are greatest amongst American Indians, and Asians were the lowest. Drowning is the leading cause of death for children 1 to 4. Falls, poisonings remain highest amongst 1 to 4. They're under the cupboards, they're playing around, they get in trouble. One of the biggest things with drowning to consider is that their head is bigger than the rest of their body. So if you have a pail and it's full of water and they go to look in, especially if there's bugs or something in there, they can actually tip themselves over and not be able to get back out. So they drown in the water in the pail. So it's always important to keep those things out of there. Keep side rails up on cribs. Remind the caregivers never to leave the crib side if the rail is down. Check equipment regularly for choking and suffocation hazards. Check temperature of water, food, drinks to prevent burns, especially in the bathtub. Look for any CPS issues. Educate the caregiver on basic home, outdoor play, and car safety measures. Install a fire alarm. Check the batteries every 6 months. And usually at this point in time, when they're going into kindergarten, they will actually look at making an evacuation plan and knowing not to hide in an emergency. So especially important with fire safety, you want to make sure that they understand to look for the fireman, not to run away from him, that he's not the boogeyman, that he's trying to help them. So some safety education also with this along the lines of not carrying hot liquids when kids are around. Don't hold a child when you're playing with hot liquids. Don't allow a young child on stoves or fireplaces. Use back burners. Turn the pot handles in. Not allow them to be around curling irons, toasters. Check temperature of formula or food before giving it to them. Safety gates to prevent stair falls. Heavy furniture, bookcases, make sure that they're completely steady and attached to the wall. Don't leave them alone on porches and balconies. Keep all medications out of reach and in a locked cabinet. Test question every time. It doesn't matter if it's in the top drawer because the child will get a stool and get up there. They need to be in a locked drawer. Childproof caps, no chips of paint, choking hazards, appropriate toys, secure loose cords with blinds, curtains, and clothing to make sure that they don't strangulate. Do not allow children to eat and play at the same time. Cut food into bite-sized pieces, especially things like nuts, hot dogs, hard candy, popcorn, and grapes. That's going to cause choking. Do not allow them to play with coin money or latex balloons. Lock rooms that are not childproof. Supervise closely around animals. Do not leave water in the bathtub or cleaning buckets. Close bathroom doors. And never leave children alone by any basin of water. Be careful with hand sanitizer and do not refer to medication as candy because they will try to get to the candy. And outdoor safety, just being very careful when they're around water, using flotation devices, never leave toys in a pool because it could be tempting the child. Crosswalk safety, children wear a bike helmet, never use the bike in the street. Booster seats, child restraint laws up to age 7, you know, all that. All right. At what age are most toddlers able to walk alone? What did we say? So they should be able to walk alone by 15 months. So 12, just starting to walk. This good. This, they should be skipping and stuff. So we're better with 15 months. Pain, again, pain is what the child says it is. So look for any nonverbal behaviors as well, facial expressions, movement, and vocalization. So we use the FLAC scale a lot in this age group, but we also look for things like furrowed brow, clenched jaw, quivering chin, kicking, legs drawn up, fearment of movement, agitation, high-pitched cry, things like that. So you'll see the Wong Baker and the FLAC scale. Some kids will be able to do the numbers eventually. In toddlers, we use FACES or FLAC a lot. There's multiple different pain scales, but that's the most that we do. Remember that most of the time in the hospital, we're doing a lot of medical play. So getting them to think about medication and medication and medicine things as much as possible. Don't ever give the child a choice in taking medication or not. They have to. And we can always give them a choice like pills, liquids, or chewable. But try not to put it in food because then you can't know how much they actually got if they throw it back up. So, age group challenges, potty training in this group. They should be potty trained by 3, but they could have issues with that, especially if they regress during times of stress. The ability to have a dry diaper for more than a few hours of time or during a nap. Regularly timed bowel movements, interest in the body, able to follow simple directions, unhappiness when feeling that they have a wet diaper. If they have the ability to vocalize that they went, and any child should start with having a few minutes at a time on the toilet to get them used to going potty. Encourage them to wash their hands, teach girls to wipe from front to back, boys to urinate in a sitting position first, and then they can move on to standing up. Encourage them with praise, stickers, treats, or new underwear. Don't be punitive if it's not happening. They have until 3. Remember, your separation anxiety happens during this time. And then tantrums, whining, crying, screaming, hitting, scratching, breath holding. Sometimes they are triggered by hunger, tiredness, being uncomfortable, sick, overstressed, attention seeking, or physical emotional problems. So if it does not get better, then take it seriously. Sibling rivalry, there will be times where you can't get them apart. So setting rules like no biting, no slamming, no pushing, no name calling, avoiding choosing sides, proper expression of feeling of anger and frustration, and teaching them to be kind to each other, sharing and comforting each other when they're hurt. Nutrition, again, by age 1, toddlers are transitioned to whole milk. At age 1 to 2, they'll need 2 servings of whole milk a day. Over 2, they should drink servings of skim or low-fat milk. And while toddlers may still be breastfeeding, support the breastfeeding mom. Provide protein, so sources of protein that are great without increasing allergies, dairy products, seafood, nuts, and soy products. Could be a source of allergen as well. So snacks should be healthy enough to partake in the nutrient, but good choices would include fruits and vegetables, milk, yogurt, cheese, whole grain crackers and cereal, nuts, and peanut butter. So according to the Dietitian Society, an appropriate serving for a child is half the adult serving. Make sure that they're getting enough iron and zinc. So especially during this time, you get picky eaters. So finicky eaters, normal to play with food. They prefer to eat only from a few selected foods. Juice and sweet drinks should be limited to 4 to 6 ounces a day, and the ideal drink choice is plain water to avoid dental caries. Dental caries, baby bottle caries, you can see, so they need to go to the dental visits Parents can provide hygiene practices with a smear of toothpaste and start flossing. Their growing independence will occur where you need to start with rules, safety, how to be a good friend, establishing routines, open-ended questions, eye contact when to show attention is being given, encourage children to bathe and dress themselves or assist with these tasks as needed. And then caregiver support, just being careful in the hospital setting that we orient caregivers to the unit as well and do everything in a step-by-step manner, involving the parents and involve the child in decision making. Reassure caregivers that it's normal to feel scared home, frustrated, not at home, alone and tired, and that it's okay for them to also care for themselves. The caregivers need to go take a nap and do things as well, especially take care of other children. At home, the safety, just having the nurse advice line, the poison control line, and 911 readily available. Numbers on the fridge when you have babysitters. Educate about signs and symptoms of common childhood infections like fever, moist cough, green, blood-tinged nasal discharge, pulling at their ears, things like that would be a problem, and they need to come home, need to go to the hospital, or need to come home from school. Having a thermometer in the home, cooling techniques, dehydration prevention, small sips of fluid, electrolyte replacement beverages, broths, popsicles. And then this is where we start talking about the brat diet when there's any problems with their diet. We go back down to the bananas, rice, applesauce, and toast, quickly advancing to soft foods because the brat diet doesn't provide nutrition. Soft, bland foods, and then solids. It's best to resume the child to a well-balanced diet. Again, assessing for child abuse all the way along the way. Simple first aid, wound cleansing using bandages and topical antibiotics. Any signs and symptoms of respiratory distress? Any respiratory distress sounds like tachypnea, retractions, flaring, accessory muscle use, tripod positioning, stridor, wheezing. Whenever there's stridor and wheezing, we end up using cool mist humidifier and warm steam bath. If there's ever a test question with drooling, that is an emergency and they need to get to 911 and in the hospital immediately. Drooling is epiglottitis. When to call 911, emergencies, not breathing, blue, extremities blue, decreased responsiveness, injured, excessive bleeding, or any perceived emergency. Remember that the age group that you worry about Tide Pods. You don't want them eating the Tide Pods. And then their role in disaster planning, just making sure that kids have a little bag ready, packed by the door in case of an emergency. In a disaster, you need to have everything you need to take care of the child. The child's safety is the responsibility of the adult, but it's the nurse's duty to advocate for the best care and safety of all pediatric patients. So telling them to have a disaster plan that includes the children. Children should have a place to meet and phone numbers of family and contact them in an emergency. So if something were to happen, a fire or a disaster, where are they going to find you? And that's kind of like the kindergarten thing where we made a plan to meet outside the home and all that good stuff. So think about daycare safety, also babysitter safety. So you always leave your number when you have somebody babysitting your kids so that they can get in touch with you. And if needed, call 911 in an emergency. Toddlers eat approximately how many times a day? If you think about this, it's probably not 3, right? So if we say 6 small meals a day is appropriate for an adult, So 6 small meals a day is appropriate for an adult. So think about that. You probably want a little more. So toddlers tend to eat 7 times a day, consuming more meals than snacks. And preschoolers eat approximately 3 meals a day with quite a few snacks during the day. So it is good to eat 6 snacks a day, more than 3 big meals. So in this chapter, we covered growth, toddler, and development, growth and development of the preschooler, the safety, the pain, age group challenges, growing independent, caregiver support, and pediatric disaster planning.